Hi everyone, I am Dr. Simon Walker and thank you so much for joining me. I'm a suicidologist and researcher based at the University of Glasgow, where I work as part of the Healthy Working Lives group, where I focus on mental health, occupational health research, and also digital innovation. I'm also someone who has had lived experience of suicide, which is why this work in particular is so personal and important to me. One of my contributions in the field so far has been the development of a theory that I call Increased Suicidality Vulnerability Period, or ISVP. This is about recognizing specific times or moments where I believe that someone is more at risk. This theory is about to be published in the Royal College of Nurses Mental Health Journal, and I'm hoping is helping to shape how we think about risk detection in nursing. So I'm here to talk to you about the Resume project, which stands for Research into Scottish Nursing Suicide and Mental Health Experiences. And I'm the creator of this project. I'm also the creator of the ASC App and the Solve framework. I know a lot about this. I've been thinking about it for many years, working on it for many years. I'm very passionate about it. And instead of just throwing all this information at you, I thought it would be best to record a short video which helps me stick to the point, I think. But I will look forward to hearing your thoughts and your questions afterwards. I'm doing this because I believe that we can and we have to do better in understanding and preventing suicide amongst our nursing workforce. So, let me introduce you to the Resume project. As many of you probably already know, nurses remain at a higher risk of suicide than many other professions. It's been theorized that nurses are up to 4 times more likely to have a suicidal incident than other female-dominated industries. However, despite this knowledge, we still don't really understand the hidden patterns of how, when, and why that risk escalates. And the Resume project is part of the equation, I suppose, a part of the research project to try and understand that. At its heart, Resume is a research program that looks to answer some very specific questions. And those questions are, what early warning signs can we detect before someone reaches a suicidal crisis event? How does distress build up over time in nursing roles in particular? And what is the true impact of suicide? Not just for the individual, but for colleagues, teams, workspaces as a whole. As I said, I'm part of the Healthy Working Lives group at the University of Glasgow, and we believe that the workplace, and particularly the relationships between colleagues and managers and staff, is a powerful place to spot early signs of distress and create moments of prevention. Resume aims to shine a light on how those professional and personal networks might help save lives. We're doing this by bringing together several strands of research. So, we're looking at historic data from places such as the Scottish Suicide Information Database, ScotSID, and also looking at some NHS records so we can look at long-term trends. We're looking at real-time distress tracking data facilitated by the ASC App, which I'm going to come on and talk to you about. But the idea is that the ASC App will also be able to not just serve as an intervention for suicide prevention and support the user, but also track data with permission on how people are feeling day to day and help us to better understand. Adding into that, qualitative interviews. So when we say qualitative interviews, we mean qualitative research can be any form of open-ended research. So usually they're interviews, also surveys. But by talking essentially to you, to nurses and those in the situation, we'll get more information, more granularity, more understanding. You are a big part of this. And being able to put these 3 strands together allows us to continue to build on our predictive modeling, which uses advanced analytics, say that 2 times fast, to try and forecast when someone might be heading into a high-risk period, which is what I described to you beforehand as an ISVP. We're in the final stages, the last minutes, the final moments of applying for funding to the Wellcome Trust under their longitudinal mental health award. This research this research funding pulls together various different strands to help us understand exactly what I've just explained. It's a big bid, it's a big project, and I need your help to help me get it across the line, to help us better understand suicide, to improve suicide prevention, and help to shape a better support system for nurses across Scotland. And it's my hope that that will then later become across the UK and possibly even worldwide. So here we have the ASC App. Now this is one of the most exciting tools. I mean, I would say that, I built it. And it stands for Assistance, Support and Care. It's clear to say this is not a treatment app. The ASC App is not for treatment. It is a research tool and an intervention. It will help us understand distress as it unfolds in real time. So let me tell you how it works. Nurses who volunteer to participate in the Resume program will be able to use the app to check in to see how they are feeling. And there are various functions to do so. It records self-reported mood, stress levels, and also moments of crisis and distress, particularly through the journal feature. It also logs behavioural signals. So for example, it looks at when you've accessed resources, including the help me support element, which is what ASC is actually based on. A big part of the app is this help feature, and it has various different names, but I sometimes think of it as the supporter-supportee element. Essentially, that part of the app is designed to be set up in tandem with two people. The individual who's using it for their own support and the individual who is willing to give that support. This is how it works, right? Let me explain. If you're in a moment of crisis, you can signal through the app by pressing the button twice, and the person that you have elected as your supporter gets a discrete alert. They can then respond to you. And if you're in a situation where that response won't come through, for example, you're in a tunnel or you've got no signal or they can't answer that response, then there is a backup MP3 recorded message which will come from that person. When I originally came up with this idea, this project, it was built on the idea of a virtual tap on the shoulder. From my own experience as someone who has attempted suicide more than once, I know that there are different reasons, there are different forms, and there are different causes or moments that lead you to that crisis moment. And I know it can feel different for different people in different ways and different times. But something that keeps coming back from the research and from my own experience is that in some cases, particularly when you have a moment of crisis, it can be a snap-second decision that you maybe are not even aware of. And in that moment, the balance lies in the next choice that you make. Now, I don't want to describe in detail my own experience, particularly on a video, namely because we have to be careful about how we describe suicide. But what I'm saying is that when I was in this situation, it came on very quickly. It came on very strong. When I was at the top of an escalator, I was having a bad day. I'd already attempted suicide once, about a couple of months before that. But I was okay. By the time I got to the bottom of the escalator, I had made a decision. And I didn't want to be here anymore. The reason I'm here talking to you today is because as I entered this narrow funnel tunnel, I was tapped on the shoulder and told to step away from what I was about to do. A stranger saved my life and probably doesn't even realize to this day that they did. I feel that that was a piece of luck. Somebody didn't even realize and just said, step back. Now, I'm trying with part of this app to synthesize that tap on the shoulder, that break in concentration. I know that when I was in that moment, there were very few things that could have broken through. But like all of us who have a smartphone, I'm usually aware of where my phone is. The ASC app has a function, as I described, where when you are in that moment and your choices seem so limited that you can tap it and it will open up a whole new response, which should help you to understand there are other choices, because you can talk to the person that you have set to talk you back. You will go through a series of responses that you have already planned, and whatever it takes for you to recognize that there are other choices, that there are things that can be done, will be in that section. Be it a funny story, a shared history, a joke, a meme, a song, you name it. It can just be a series of responses and things to remind you that things can improve. And it's tailored by you, because you of all people will know what will help you feel slightly better in that moment. And that's what it's for. To pause and step back from that moment of unsafety. For us, in this research project, the ASC app is designed to get out there and support you. And it's designed to be that virtual tap on the shoulder, while also having a host of resources to help you in a day-to-day basis to manage your own mental health. And for the supporter to help manage this person you are supporting, their mental health, as well as your own. We're very, very aware of the issue of safeguarding. In some cases, it is possible to take one vulnerable person, and if that situation isn't managed properly, it can become two vulnerable people. And this is something that I'm working very hard to avoid. So these conversations are designed to set in place a series of safeguards to protect all the people involved. But that particular element and the app itself isn't just valuable to you, the user, or even the supporter, but the data that we collect anonymously will allow us to understand key characteristics of when these things are needed, which leads us to be better prepared to protect and prevent. This data is gold and could save lives, and I'm really hoping that it will. Separate to the ASC app is the Solve framework. Now, originally I wasn't going to include Solve as part of this particular video, but conversations with colleagues recently have allowed me to think that maybe I should quickly go over what it is. The Solve framework is a very simple, practical tool to guide conversations when someone discloses suicidal thoughts. Again, personal experience is part of this. I was in a situation where I told someone that I had had a suicidal incident and I was feeling vulnerable. And in that moment, they told me they didn't have time. Now, I was upset at that moment, but what that then turned into was me thinking about how could they have responded to that situation differently, even if they were in a situation where they felt they weren't able to help or they didn't have time to help. A lot of the suicide prevention or understanding resources out there require an element of training. Solve doesn't. It's not clinical. It's not particularly complicated. Although it hurts me to say that. It is very simple. I designed it. It can't be that complicated. Solve stands for support, open, legitimize, visualize, and end safely. There are 5 steps to the Solve framework. In each case, if someone discloses suicidal ideation or vulnerability to you, you are able to pull it up, and it gives you key phrases to use, and it talks you through the process. For example, it'll give you a sentence on how to offer genuine empathy, which I know sounds like a contradiction in terms. It'll help you to ask questions rather than jump in with a solution. It will remind you to legitimize that the person who has confided in you has done so, and that you are happy to hear them, and that there is nothing to be ashamed of. It will help you visualize with that person next steps, where they can go forward, pathways, signposting, even small ones. And it will help you end that conversation safely as you signpost them to a service that can help them. On the newest version of Solve, we've even included a traffic light process where you know where that person may need to go next. Solve is not about you, the person who has just been told this information, becoming responsible for it. Quite the opposite. Solve is about protecting both of you in that situation. It's about telling you that it's okay not to be responsible for this person who has had this crisis. But you don't need to be responsible to be helpful, to be caring, to be empathetic. What you can do is you can listen, you can take in what you can, what is comfortable to you, and say, let's take this forward, let's help. Here is what we can do. And that protects you and hopefully them. Again, Solve is a framework that we're testing, and I'd love your thoughts and feedback on it. So ultimately that leads me to what I really need from you, having sat through this video. I need your support. But more than that, I need your input. I need your views. I need your opinions. I need your feedback. And I need you to be honest. The only way that I can get these elements out, so I can further my research, so I can better understand suicide as an aid to prevention, is if I have the involvement of individuals like you who see value in the work that me and my team are doing and give us feedback on how to make that better. There's going to be questions like, would you be comfortable with this kind of digital tool? Would you use it? Would you feel safe acting as a supporter or using it as someone who needs support? Questions about privacy we can talk about. Your insights will direct how this works. Are we asking the right questions? Are we looking in the right place? Because I'm not a nurse. I'm an academic. I'm not a clinician. I'm a suicidologist. I understand this from my own experience, but my experience is not yours. And the only way I can fully understand here is if I have your experiences, your thoughts, your perceptions. So I'm asking for you to help me move this project forward. I'm really proud of the Resume project. It's not the first time we've gone for funding, and if it doesn't work, it won't be the last. But I'll keep banging this drum. I think there is work to be done to protect nurses, to protect a whole range of people. But right now I'm focused on nurses. And I think that this project has merit. I think that we can find out more, and from understanding more, we can do more. We can help to discuss it more openly, more safely. I think the ASC app could be a useful tool in the arsenal of protecting people and protecting and supporting mental health, particularly the virtual tap on the shoulder. I'm particularly proud of the Solve framework, something that was designed from a poor experience that, for me, I'm hoping will help other people. But a long time before I became a suicidologist and worked in occupational health research and so on and so on and so on, I used to be a historian. And I became a historian because I love stories. I love people's experiences. I love hearing about them. And that is potentially the primary purpose of Resume, is to understand what is happening and has happened to you as nurses, as people connected to this field. So I really thank you for watching the video. I really thank you for contributing to the study, and ask me questions. Get in touch. If you're here for the actual event, ask me questions right now. Grill me on it and give me as much feedback as you can. And thank you. Thank you so much.